Well, thank you for joining me today. This is Mark Raderink. I am an integrative physician located here in Albuquerque, New Mexico. And today I'd like to talk to you a little bit about the cardiovascular triad, which is something we utilize here at Expanding Choices for cardiovascular disease prevention. As we all know, or we should know, cardiovascular disease is the #1 killer of Americans. In fact, it's the #1 killer of humans worldwide. This includes heart attacks and strokes. Nevertheless, we know that from places such as the Cleveland Clinic and the Mayo Clinic, they state that 80 to 90% of heart attacks are preventable and 50% of strokes. This is a massive amount of suffering that is endured by individuals and their families, as well as a huge financial burden on the healthcare system. And if we can prevent it and should, why are we not doing that? And that is a big focus of our work here at Expanding Choices. And the cardiovascular triad, I like to call it, encompasses 3 things. And first is testing for prevention. We recommend all of our patients receive a comprehensive blood chemistry analysis every year. This is the most cost-effective preventive measure one can do. It's simple, typically covered with insurance, and even if it's not that expensive, and can clue you into disease processes at its earliest where you can correct it. Secondly, we recommend the use of a HeartSmart IMT Plus ultrasound of the carotid artery in the neck. This has been well studied and published. It has been utilized at University of California, Irvine in their preventive cardiology service. They have published an article recently in this April, and it is found to be very effective at identifying cardiovascular disease at its earliest. It's simple and it's painless, and it's something we recommend for many people, depending on their age and their level of health, once a year. For some people, maybe every 2 or 3 years. The next leg of this triangle involves dietary measures. Now, the reason so many heart attacks and strokes are preventable is because the culprit is inflammation. And inflammation is something we can control quite effectively through dietary means. And here at Expanding Choices, we utilize a low carbohydrate, high healthy fat diet. And for many people, this would be a ketogenic diet. Now, in published literature, the low carbohydrate, high fat diet has been found to be the most anti-inflammatory, particularly when compared to a low fat diet. So we have a program, a ketogenic program, which is very beneficial for heart health and for anti-aging, that we work with our patients on such a diet. So we're reducing inflammation through our testing. We're looking at cardiovascular disease at its earliest and setting up a treatment program to help with this. Now, the third leg of our triangle is unique. It is something that is a little different from the other legs, but we're very excited about here, the technology, what this is, and what it can do for you. And this is the Beemer. It's a pulsed electromagnetic field device. It's been around for 17 to 18 years. It was developed in Germany. It is utilized by NASA and increases the flow through the microcirculation, which through this increases the oxygenation of tissues, increases the amount of energy produced, and has effect on all organ systems, and including the cardiovascular system, to help the heart to work better and, most importantly, to prevent disease. So through utilization of appropriate diagnostic testing, an anti-inflammatory diet, and the use of Beemer therapy, This is an excellent modality so that you can be one of those that prevents a heart attack or stroke and does not have to suffer the consequences of this disease. If you would like more information on any of this, please give our clinic a call. We're at Expanding Choices in Uptown Albuquerque. Our phone number is 508-1745. Again, the phone number is 508-1745. We look forward to working with you. Thank you so much for joining me today, and we'll meet up again on future videos.